You are now listening to On One Radio. I'm your host, Tony Williams. This is Let's Talk, and I have some breaking news for you. This is about your health. We have a deadly virus outbreak that hits dozens of communities, and they're at critical risk. Now, the fifth case of deadly EEE, that's triple E, virus confirmed in Massachusetts. 36 communities at critical risk. The Massachusetts Department of Public Health announced that laboratory testing has confirmed another new case at Eastern Equine Encephalitis virus infection. A man in his 70s from southwestern Middlesex County, bringing the total number of human cases of triple E to 5 this year in Massachusetts. As a result, the risk level in Ashland, Hopedale and Milford has been raised to critical, and the risk level in Bellingham, Blackstone and Millville has been raised to high. In total, there are 32 communities now at risk, 39 at high risk, and 121 at moderate risk for the triple E virus in Massachusetts. There have also been 9 confirmed cases of triple E this year in animals, 8 horses and 1 goat. Now, the triple E virus is a rare cause of brain infections, encephalitis. Only a few cases are reported in the United States each year. Most occur in eastern or Gulf Coast states. Approximately 30% of people with triple E die, and many survivors have ongoing neurologic problems. Now, this is very important, and I want everyone to be aware, because I want everyone to be as safe as possible. Now, the symptoms. The incubation period for triple E virus, the time from infected mosquito bite people, to onset of illness ranges from 4 to 10 days. Triple E virus infection can result in one of 2 types of illness: systemic or encephalitic, involving swelling of the brain. The type of illness will depend on the age of the person and other host factors. It is possible that some people who become infected with triple E virus may be asymptomatic, which means will not develop any symptoms. Now, systemic infection has an abrupt onset and is characterized by chills, fever, malaise, and myalgia. The illness lasts 1 to 2 weeks, and recovery is complete when there is no central nervous system involvement. In infants, encephalitic form is categorized by abrupt onset. In older children and adults, encephalitis is manifested after a few days of systemic illness. Signs and symptoms in encephalitic patients are fever, headache, irritability, restlessness, drowsiness, anorexia, vomiting, diarrhea, cyanosis, convulsions, and coma. That's not good. So be aware of those. Approximately a third of all people with triple E die from the disease. Death usually occurs 2 to 10 days after onset of symptoms, but occur much later. Of those who recover, many are left with disabling and progressive mental and physical situations, which can range from minimal brain dysfunction to severe intellectual impairment, personality disorders, seizures, paralysis, and cranial nerve dysfunction. Many patients with severe situation die within a few years. Now, as far as treatment, no human vaccine against the triple E virus or specific antiviral treatment for clinical triple E virus infections is available. Patients with suspected triple E should be evaluated by a healthcare provider to receive a proper diagnosis, to get tested, and supportive treatment is provided. Now, there's a lot going on with this, and people really need to be aware. And if you feel like you have any of those symptoms, please go to the nearest emergency room or your primary care. Make sure it's reported to the CDC. Just go get help as soon as possible with this, because this is a booger, and we are praying for all those affected by the triple E virus. So don't wait. In the United States, 7 human cases of triple E are reported annually. To ensure standardization of reporting across the country, CDC recommends that the national surveillance case definition be constantly applied by all state health departments. Most cases of triple E have been reported from Florida, Massachusetts, New York, and North Carolina. The triple E virus transmission is most common in and around freshwater hardwood swamps in the Atlantic and Gulf Coast states and the Great Lakes region. And this was provided by the Department of Health, Massachusetts. So please, everyone, be aware and get treated if you feel like you have those symptoms. If you notice those symptoms in anyone else, please make sure they get this information. It is imperative. This has been your community breaking news from On One Radio. This has been Let's Talk with Tony Williams. Have a great day.